Good evening. My name is Shelley Bixler, and I am going to be presenting my MSN Final Project PowerPoint. With this project, I did a 13-week educational intervention in combination with Suncoast Hospice of Hillsborough and Tidewell Hospice of Sarasota and Manatee counties. The project focused on Suncoast Hospice of Hillsborough, specifically with our admissions nurses. They handle fast-paced hospital workflows, and we were seeing delays in same-day admissions. And a lot of time came down to the communication gaps. There was inconsistent documentation and workflow issues, and it was slowing everyone down and delaying patients from getting on service. This impacted the patients and the family's experience as well. That's really what pushed the need for this project. We need a structure, a focused way to help staff feel more confident and streamline their day and get patients into hospice quicker and more smoothly. Before starting, I took a close look at what was actually causing the admissions delays. The pre-survey results confirmed what we expected. There were gaps in communications, workflow process, and there was little confidence in their documentation. Nurses shared practical challenges that were happening daily, especially getting charts opened, entering medications, and coordinating with hospital staff. I had a total of 9 admission nurses that I did a pre and post survey on. Feeling absolutely 100% confident would have been a score of 450. The pre-survey, the nurses scored 367 out of 450, which showed there was room for improvement. Conversations during stand-up also made it clear that staff wanted more support and practical tools. So with my project, I did 4 lessons. Lesson A, focus, improving communication between hospital case managers, social workers, and hospice admission staff. The key points we reviewed were standardized handoff process and SBAR communication, building relationships with hospital staff for smoother referrals, and clear escalation pathways. Lesson B, streamline charting and documentation to speed up admissions. The key points in that lesson were best practices for accurate and efficient charting, avoiding common errors and delayed approvals, and using templates, shortcuts, or standardized documentation tools. Lesson C focused on organizing tasks to minimize delays. The key points were prioritizing referrals during high volume days, delegate via triage, coordinating transportation, medication delivery, and consents, and managing multiple admissions without sacrificing quality. Lesson D, we focused on identifying and overcoming common real-world barriers. We addressed delays with insurance, DME, physician discharge orders. We did some role-playing and scenarios about barrier resolution, reviewed case studies of same-day admissions and lessons learned. SMART goal specific. The goal of this project was intentionally very specific to provide a 13-week educational plan for admission nurses to improve same-day admissions. We outlined exactly what would be involved, where the education would take place, and what barriers we wanted to address. The why was the biggest driver: improving workflow, reducing lag time, and making the process smoother for nurses and patients. Having the plan tied directly to daily stand-ups and real-time hospital needs helped everyone focus and remain realistic on the end term. Being so specific made it easier to follow, implement, and measure. To truly know if the project worked, we needed outcomes. We looked for at least 20% improvement in staff confidence and knowledge, plus a 15% reduction in lag times for same-day admissions. We also tracked weekly patterns by reviewing referrals to admissions timing. We practiced during lessons. And nursing feedback was also important during our morning stand-ups. Between the surveys and the operational data, we had a clear picture of what was changing. The measurable pieces helped confirm that education wasn't just helpful, it was actually improving real numbers. And that's what we care about. The goal was definitely achievable because we had leadership support, access to data, and dedicated meeting times to build our workflow. We also modeled the project after similar initiatives that have worked well in the other hospice settings. Having the right tools like surveys, EHR access, daily collaboration time made this very doable. The nurses were also engaged, which helped a lot. Even though the project stretched everyone a little bit, it was still realistic because all of the pieces were already in place. The goal was challenging but not overwhelming, and everyone kept motivated. The project was realistic because the timeline made sense and the goals were achievable within that 13-week window. We already had daily stand-ups and workflow touch points built into our normal routine, so adding education fit naturally. Setting deadlines like collecting surveys in week 1 and reviewing all data by November 16th kept everything on track. The final goal date of November 23rd gave us a clear finish line. Knowing we'd had successfully completed similar improvements in the past also gave confidence that this was absolutely doable as we planned. This timeline shows how the project rolled out week by week. Week 1 was all about reviewing the project with staff and collecting baseline surveys. Weeks 2 through 5 were the heart of the education. Communication, documentation, workflow, problem-solving lessons. Weeks 6 through 12 focused on applying what we learned in real time, reviewing patterns, addressing issues as they came up. Week 13 wrapped up the project. We had the final survey to take a deeper look at the nurses' improvements and also through our Salesforce data. This structure kept the project organized and gave staff time to practice each new skill. The survey was designed to capture confidence, knowledge, and workflow awareness across 10 key areas. We focused on documentation, time management, understanding of barriers, collaboration, and the overall flow of hospital referral to admission process. These are the areas that nurses deal with constantly, so it gave us meaningful insight. Using the same survey before and after, the project helped us measure growth in a clear, fair way. Staff felt the questions were straightforward and reflective of what they handle every day, making the results even more valuable. This chart compares the pre-survey and the post-survey scores. We started with a baseline score of 367 out of 450. After the education and 13 weeks of practice, the score increased to 398. That's a solid improvement that shows that staff felt more confident and knowledgeable. Even though the education ended, the confidence boost was real and measurable. This chart is one of the clearest indicators that the project had a meaningful impact. It reflects both what staff learned and how much more they felt prepared in their role. Lesson A focused on communication and collaboration with hospital staff. We learned how valuable face-to-face communication was. This lesson focused on documentation challenges, especially how time-consuming medications entry can be. We talked about always streamlining the EHR work and how differently nurses help draft MAC forms before presenting them to the physicians. Time management. Lesson C covered time management and workflow optimization. Lesson D was problem solving. Manage delays, call DME to expedite it, order equipment early, and avoid late transportations. Stakeholder reception. All of the stakeholders were highly engaged. They reported confidence boost, leadership was very supportive, and navigations was active. Sustainability. A big part of this project was making sure improvements could last. The daily stand-ups naturally support ongoing conversions. This project helped strengthen several AONL competencies. Communication was a big one, especially working across hospital teams. Leadership and relationship management grew within guiding the staff, running the lessons, and reviewing data together. What I learned how powerful education can be when it's focused on real, everyday issues. The staff were already doing great work, they just needed the practical tools, clearer workflows, and a space to talk throughout challenges. I also learned how important communication is and teamwork, especially between nurses, navigators, and hospital staff. This project confirmed that small, consistent improvements can make a big difference in patient care and team workflow. Thank you.